the COVID-19 pandemic has had a negative effect on the child vaccination rate, with many parents neglecting to take their children for routine immunizations. According to the Health Department, only 61% of South African children were vaccinated by April this year. Now, the department is on an immunization drive to help parents who may have delayed or missed key vaccinations and to give them an opportunity to catch up. All parents are urged to ensure that their children are vaccinated by the end of next month. Not much time left. Let's get you a sense of how this is going to unfold. Bring in the Department of Health's acting Chief Director of School Health. That's Dr. Lesley Bamford. Doc, thanks very much for your time. Welcome to the AM report. I've seen some academics actually saying that South Africa is sitting on a ticking time bomb, given the risks posed by COVID-19 and now the risks we're learning now of children not being vaccinated in time. To what extent would you agree with that sentiment?
Well, good morning, and good morning to the viewers. So I'm not sure that we would call it a ticking time bomb, but we certainly are concerned. Children, luckily, have been less affected by COVID-19 if we talk about direct effects. But there's no doubt that many of the indirect effects of the COVID-19 have adversely affected children. We know that people's lives have been disrupted. In some instances, our health services have also been disrupted. In South Africa, we do already have less than optimal immunization coverage. And we have seen that during this year, our immunization coverage rates have fallen further. And so, particularly in some areas, they are sitting at levels where we begin to be concerned that we may have outbreaks of vaccine-preventable diseases. And this would be a real tragedy. As I say, children have been less affected by COVID-19, but it would really be a tragedy if we were now to have, for example, measles outbreaks and to have deaths from young children because of these diseases that are easily preventable through immunization.
Links well to my next question. I think there's a lot to be said about the possible health impacts that not immunizing children will have on not only the children themselves, but the communities that they also live in. Speak to us a bit more about that.
So that's correct. Obviously, having your child immunized has direct benefits for the child. The child will be protected from vaccine-preventable diseases. But we also have this concept of herd immunity, that by immunizing your own child, you protect other children and adults in the community. Because the more people who are protected against vaccine-preventable diseases, the less chance there is of those infections circulating in the community and therefore infecting people who are susceptible to those diseases.
The complexity that comes with having children vaccinated is that a lot of the time they don't have much autonomy. In fact, I've just recently learned of the anti-vax movement, which is apparently a whole lot more prominent overseas than it is in South Africa. Essentially, parents who don't believe in vaccinations for all sorts of reasons. How much of a problem has it been for the health department, at least insofar as getting this drive up and running?
So in South Africa currently, particularly with childhood immunizations, we don't seem to have a particular problem with people not wanting their children to be vaccinated. But there are many children who aren't vaccinated. We think this is due to two factors. The first is that life is busy for parents. They forget. We have quite good coverage in our early vaccinations, our 6, 10, and 14-week immunizations, where we think immunizations are at the forefront of parents' minds. They know that their children should be immunized, and in most cases, they take their children to be immunized. However, some of the later doses, 6 months, 1 year, 18 months, people simply forget. Or during COVID-19, they may not be able to or feel fearful or anxious about visiting our health facilities. So this is really why we are having this catch-up drive. The catch-up drive starts in November and will actually run until the end of March next year. In these first 3 months, we are prioritizing what we call our 12 priority districts, which are primarily the metros in the country, because that's where the largest number of unvaccinated children are to be found. There are 4 aims of the drive. The first is really to restore immunization services, to give a very clear message to caregivers, families, as well as our healthcare providers, that despite the disruption of COVID, we are now getting immunizations back on track. We need to make sure that our immunization services are up and running and providing immunizations. The second then, of course, is the catch-up component, making sure that children who missed immunizations during the pandemic access our health facilities and are immunized. The third then is to make sure that we strengthen our catch-up immunization in the long term. We think that sometimes caregivers forget to take a child, maybe at 6 months, and then are not aware that actually they can still take that child, even if the child is 9 months old, 1 year, to go and get what we call a catch-up dose. So we need to strengthen our catch-up service provision in the long term. Then finally, to make sure that children access other key child health services that they may have missed during COVID-19. So the message to caregivers is very clear. Please check whether your child is due or has missed any immunization. Every child should have a road to health book, and so it's easy to check if your child requires immunization. If you're not sure, talk to a community health worker or another health professional. And if your child is due for immunization, please take them to one of our health facilities to get those doses.
Right. And Doc, how far back can we actually stretch this catch-up, or let me say eligibility for a catch-up dose? I think the last marker you mentioned was about 18 months. If my child hasn't been vaccinated at that point and they're 2 years old today, has that horse already bolted, or is it something I also still need to consider?
Well, it's a little bit variable, and some vaccines there is a cutoff dose, cutoff age, after which we don't give those vaccines. However, in general, in this catch-up drive, we are targeting all children up to 5 years of age. So even a child who is 4 or 4.5 years old may be eligible to receive some catch-up doses. Also, just to mention, we are targeting under 5s in this campaign, but we also urge parents not to forget that children should also be immunized at 6 years and 12 years of age. And again, whilst that's not a particular focus of this drive, caregivers are encouraged to make sure that their children also receive those doses. Particularly the 6-year dose. Many schools want children to have had that dose before they admit them to school. So that's another reason to make sure that your child is fully immunized.
Well, hopefully the message is loud and clear. Thanks very much for making time for us here on the AM Report so we can do our part in spreading this awareness. Certainly appreciate your time. Dr. Lesley Bamford is with the Health Department. In fact, she's the Acting Chief Director of Child, Youth and School Health. Appreciate your insights indeed.